Good afternoon, everyone. My name is Amanda Billups, and I'm a clinical professional development educator at North Shore University Hospital. Myself, with Ruby Curian, are your head scout leaders. So, you thought campaign was done. We just took a small little pause because our magnet survey was here. So, we are in that window for Joint Commission. Now more than ever, campaign is important. And we are going to be doing a special edition boot camp style. What does that mean? So all those activities, 1 through 3, that we messaged out to you with our one-pagers and instructional videos are going to be evaluated via a monitoring tool. So we have a monitoring tool that we are going to push out to all of our managers and scout leaders so that we can evaluate all of the hard work that we've done. This monitoring tool goes over a couple of indications, and I'm just going to run through it real fast. The indication number 1 is one pain scale launched? So we know we do not need more than one pain scale launched on a patient, but a pain scale must be launched. 2, the appropriate pain scale is utilized. So remember when activity number 1, we went over the 5 different types of pain scales for our patient population. This will be an indication. Pain medication administered as ordered. So this is number 3. So for example, you have PRN Tylenol for mild pain of 1 through 3. And we should see that it's administered for a pain that is reported 1 through 3. Pain reassessment is appropriate. For instance, even our around-the-clock pain medication still needs to be having a reassessment done. So that's something that we're going to be looking at. And just to recap, our PO reassessment time is 60. Our subcutaneous and IM routes are 30. And our IV is 15 to 30 minute reassessment time. All non-pharmacological interventions, again, administered by the clinician, it's that 60-minute reassessment. And if the patient independently engages in self-care or modalities that reduce pain, it is documented a minimum of once per shift. So essentially, that is all that we need on our monitoring tool. Important information for our clinical ladder nurses. You can get 1 point per monitoring tool. There are 10 charts that you are going to pull for a patient and answering those questions that I just went over, and you can get 1 point per monitoring tool. This is under the bucket of quality and safety. So what do you do with these monitoring tools? Well, you are going to send them to myself and Ruby, and we will be able to collect the data there and see how all of your units are doing. Again, I do want to reiterate that if at any point you see a pattern or you hear, let's say, feedback from the staff that they're unsure of something that we've covered through one of our activities, you can absolutely revisit and reinfuse one of those campaign activities into your briefs and educate staff in small groups or individually, and make sure that you document that as your education time so that you can get clinical ladder points and keep a roster. So at any point, we can always revisit and revamp some of those campaign activities. Please utilize myself and Ruby as your point and resources. If, let's say, there is one topic that you particularly want help with, or you just need a simple, just a different kind of way to educate the unit. So don't forget to do your monitoring tools. This is our boot camp edition, and then you're going to submit this to myself and Ruby. I want to say that this campaign has been an amazing journey, and thank you so much for all your hard work and efforts, and we will see you on the units.